Hello, welcome all to our channel. Speaking English. Thank you for watching and supporting our previous speaking videos. We value your comments and suggestions. Please continue to subscribe our channel for latest speaking roleplay contents. Our aim is to make speaking tasks more friendly and simplify them by providing lots of ideas, and you can develop them into beautiful structures. Today, we're going to discuss about speaking module in detail. Basic speaking knowledge. Speaking assessment criteria. Grading and marks. Warm-up session. Possible expected scenarios. How to use the roleplay card. And the most important part, how to do a beautiful conversation. Steps in speaking. Let's begin our speaking session. Hi, good morning candidates. Myself, Ajit, and she is Divya. Today in this session we're going to explain basics of speaking.
Basic aim of this module is to effectively communicate in a real-life context through the use of role plays.
The approximate time for speaking module is 20 minutes, which includes introduction, warm-up session, and 2 role plays.
The 2 role plays will be specific to each profession.
Hello, I am going to explain about speaking assessment criteria and the level descriptors. In that we have linguistic criteria and clinical communication criteria. Linguistic criteria is divided into 4. 1. Intelligibility. 2. Fluency. 3. Appropriateness of language, and 4. Resource of grammar and expression. According to this criteria, we have a band from 0 to 6. Next is clinical communication criteria, also has 5 layers. 1. Relationship building. 2. Understanding and incorporating the patient's perception. 3. Providing structure. 4. Information gathering. And 5. Information giving. In this also we have a band from 0 to 3.
Now we will discuss about grades and marks in speaking module. In speaking, like all modules, we have grade from A to E and marks from 500 to 0. To score grade A, you need to score a minimum of 450 marks and above, which is equivalent to band 8 to 9. Grade B from 350 to 449 marks, and you will get a band between 7 to 7.5. For grade C+, you need to have between 300 and 349 marks. 6.5 is the band. From there we have grade C, 200 to 299 mark, and band score is 5.5 to 6. Grade D is 100 to 199 and E is below 100 marks. Band score is less than 5.5 for grade D and E.
Next is speaking module introduction and warm-up session.
The introduction and warm-up sessions are not evaluated, but like we say, first impression is the best impression, so give your best.
Now we're going to act the sessions. I am the interlocutor and she is the candidate. Good morning, my name is Anthony. I am the examiner for the Occupational English Test, conducting on the 11th of November 2020. Can you say your name for record?
Good morning, my name is Maggie Deep.
What is your candidate number, please?
My candidate number is 621895329.
And you are taking the test as a nurse, is that correct?
Yes, that's correct.
Can I see your ID or passport, please?
Sure, here it is.
Now, we're moving to warm-up session. They are not assessed. Basically, it's a chance to get each other voices.
Warm-up sessions can last up to 2 to 3 minutes, and you can expect 3 to 5 questions. For example,
self-introduction.
Why are you taking Occupational English Test?
Your dream country and future plan.
Qualities of a nurse.
Explain a difficult situation you encountered as a nurse.
Explain your strength and weakness.
These are some questions you can expect in warm-up session. We're going to provide you a detailed explanation about warm-up session in our coming video. Now, we will discuss role-play scenarios. The role-play scenarios are based on real situations you are likely to face in your work as a healthcare worker. There are a variety of possible settings for the role-play. To name a few.
Any hospital department, like emergency department, hospital ward, intensive care unit, day procedure unit, preoperative and postoperative unit,
community health center and suburban medical clinic,
hospital outpatient department and doctor's room,
home visit and school.
Lastly, you can expect any scenario depending upon roleplay.
Hello, we will explain about how to use roleplay.
Well, if we follow a simple method called RUSC, we can easily manage the task. But how? No worries, we will explain.
RUSC is simply read, understand, start, and control the roleplay.
1. Read. The first important lesson is to read the roleplay card carefully and act accordingly.
2. Understand. Try to understand the roleplay card information to judge the situation and to begin.
3. Start. Under any scenario, it is your task to start the roleplay and do not wait for your examiner to begin.
And 4. Control. Being a medical professional, you need to be in control of how the roleplay will develop.
Lastly, we're going to discuss the most important part, the roleplay. We have to do 2 roleplay and each can last 5 minutes. You will get preparation time for 3 minutes in both roleplays. During this time, if you have any doubts or need clarity in pronunciation of a word or name, you can ask your examiner.
During 3 minutes of preparation, if needed, you can write notes in the roleplay card. You need to give back the task card at the end of roleplay.
During roleplay, if needed you can have a look at your card, but be vigilant, and listen to your examiner, and respond accordingly.
Let's start with step-by-step roleplay process.
1. Briefly introduce yourself depends upon the scenario. For example, hospital ward. Good afternoon, I am the nurse on this ward and I am going to look after you today. You can call me Anam. Or if it's a home visit, you can introduce by saying, my name is Anam, one of the community health nurse working in this locality.
2. Ask questions to make an initial diagnosis. 1. Collect relevant information. A common mistake is for candidates to ask too many questions. For example, if needed only collect history. If patient is admitted in the ward for few days or post-operatively, no need to collect history, unless requested in the roleplay. Most importantly, you are wasting a lot of time. If suppose your roleplay is a patient with bronchitis, you could ask,
how long has the discomfort been going on?
And you say you smoke. How many cigarettes per day?
Have you ever tried to stop smoking?
These questions will be enough to make an initial diagnosis.
3. Respond carefully to patients' responses. Here, it is very important that you respond with empathy and care. Please be careful with the type of language, tone and voice register you use for each situation.
For example, when a patient says I'm in pain, you can't say no problem, we will help you.
Instead of that, you need to say, I am so sorry, let me do something for your pain in an empathetical manner. Patient responses will also test your ability to listen to others and to act.
4. Provide an explanation of the condition and respond to further questions and concerns of the patient. Although, OET not test your medical knowledge, but you need to know some basic knowledge about conditions.
The ability to communicate that knowledge to the patient, either as an explanation of the condition or as an option for treatment. For example, if the roleplay asks you to advise a patient to stop drinking alcohol, then you need some knowledge about alcohol quitting therapies.
Therefore, it is vital to practice as many as different roleplays.
5. Provide advice and reassurance as required. After diagnosing and providing explanation of the condition and treatment, your task now is to give the patient advice and reassurance. Advice.
1. It is important for you to start doing some exercises to lose your weight.
2. It is imperative that you take your medicine regularly to prevent further complications.
3. It is recommended that you try to change your lifestyle. Next, we will provide you some structures for reassurance. Reassurance.
I apologize for the rough experience you had. I assure you that this will never happen again.
Slight changes in your daily routine will definitely help in making a huge difference to your health.
Your concerns are understandable, but let me reassure you, we are well trained and equipped to handle any emergency situation. Empathetical sentence examples.
Empathy.
1. I can see why you have this concern. If I were you, I would also react in the same way.
I can see that this has been very difficult for you to cope with.
I can sense how angry you have been feeling about your illness.
I can appreciate how difficult it is for you to talk about this.
I know how emotionally draining this must be for you.
Finally, some examples. How to tackle a patient who refused treatment or medication.
I understand that the final decision is up to you. However, you must understand the risks involved with this. Is it okay if I can discuss that with you?
I appreciate what you are saying, and it's your right to get discharged or refuse treatment. But, can I explain some problems associated with refusing treatment with your current condition?
6. Conclude your task. Always remember to keep your conclusion short, simple and understandable.
At the end of the role play, if you have time, you can paraphrase what has been discussed.
Or else you can ask. That being said, do you have any other concerns? Or, I believe I have cleared all your doubts or concerns.
Thank you for listening me. I am leaving now. You can continue to take rest in between if you need some help. Please ring the bell. Remember, we are here to help you.
Regarding leaflet or booklet examples,
I have some booklets about this condition, so if you know a little more about what it is, what to expect, and what help is available, I hope you would not feel so worried. If you are interested, I can bring them for you.
If you need more clarity about your diet or condition, I can provide you a leaflet.
Examples for persuading.
If you did not follow my instructions, you will have bad effects on your health. If you did not stop smoking, you will end up with cardiac or lung diseases.
If you did not walk every day, I am afraid to say that you will have obesity.
Wishing sentences at the end of roleplay. I wish you a speedy recovery, if it's a recoverable condition like pneumonia or for surgical patients.
I wish you a safe delivery and a healthy baby for you and your husband. This can be used when you interact with pregnant women.
For non-recoverable condition, I wish you a healthy future ahead. Example: cancer or osteoarthritis patients.
Patients who come for immunization before traveling, we can say, I wish you a happy and safe journey.
Thank you guys for watching this video. Hope it helped you to learn something new. If you have any queries, please comment, we will get back to you. Wishing all the very best and see you on our next video. Please continue to watch, support and subscribe our channel. Press the like button if you enjoy the content. Speaking Aiders team.